Welcome to our microlearning series, brought to you by Centene Behavioral Health's Clinical Provider Training Team. This module focuses on care coordination. This microlearning is one of 4 in a series. The topics covered in this series are care coordination, treatment planning, titration of services, and discharge planning. Check out each microlearning for more information on the topics listed. By the end of this module, you will be able to identify the rationale behind care coordination, list the various types of care coordination activities, verbalize the benefits of care coordination, review possible risks due to lack of care coordination, and identify potential barriers faced when coordinating care. Let's start with a broad definition. According to the Agency for Healthcare Quality and Research, care coordination is the deliberate organization of member care activities between 2 or more participants, including the member, involved in a member's care, to facilitate the appropriate delivery of healthcare services. Organizing care involves the marshaling of personnel and other resources needed to carry out all required member care activities, and is often managed by the exchange of information among participants responsible for different aspects of care. The goal of care coordination is to meet the members' needs and preferences in delivery of high-quality and high-value care. Care coordination is an essential element in treatment planning, services titration, and discharge planning processes. So, what are the benefits of care coordination? This model has been identified as a key strategy that has the potential to improve the healthcare system's overall effectiveness, safety, and efficiency. Well-designed, targeted care coordination that is delivered to the right people can improve outcomes for everyone: members, providers, and payers. Additionally, care coordination helps to facilitate more comprehensive treatment planning that may lead to more appropriate services titration. Because care coordination can consist of anything that bridges gaps along the care pathway, it's important to think about who all may be involved in the care coordination process. We know that a holistic approach to healthcare typically results in the best outcomes, regardless of the level of care the member may be in. Thus, care coordination may include a variety of individuals. Examples may include behavioral health providers, such as social workers, counselors, or psychiatrists; physical health providers, such as a primary care physician or a pharmacist; specialty care services, such as physical therapists, occupational therapists, substance use counselors, or speech therapy; educational and community supports, such as teachers, school psychologists, or mentors; or family members, such as a parent, guardian, spouse, or sibling. All of these people can be considered integral members of the treatment team, with each having a unique role in treatment planning and discharge processes. Because there may be many individuals involved in care coordination, we must also consider which method of care coordination may be most appropriate based on the member's needs. Depending on the complexity or severity of the member's concerns, a provider may be more or less involved in care coordination activities. Remember, in order to protect our members' private health information, releases of information must be signed by the member or their guardian prior to any outreach. At minimum, it is recommended providers request and review records from previous or current providers. The member may require more coordination that may occur via phone, fax, mail, or email contact. In some circumstances, there may be a need for a virtual or face-to-face meeting. It is also considered a best practice to document all outreach efforts to show reasonable efforts for coordination have been made. So, what could happen if we do not coordinate care? There are different circumstances that may arise. One primary issue is that there is the risk of having multiple providers treating different diagnoses for the member. For example, a member may be seen for therapy and have a diagnosis of bipolar disorder by the therapist, but may have received a diagnosis of ADHD by their psychiatrist at a different agency. Having multiple treatment plans with different goals can complicate the treatment process for the member. We also know that evidence-based treatment for both of these conditions may be different given the way they present. If we do not communicate with each other, the person will likely not improve. Another risk of not coordinating care is that the individual's behavioral health symptoms may become exacerbated. If a member is experiencing high acuity with a physical health condition, yet is not communicating with their behavioral health provider about their medical status, it could lead to the behavioral health condition worsening. Both of these circumstances, in the short and long term, have the potential to lead to poor general prognosis of the member's condition. Centene Behavioral Health does recognize that barriers may be present for providers in their efforts to coordinate care. These barriers may exist from the member and/or the systemic levels. From the member's standpoint, we recognize that our members or their guardians may have a difficult time recalling a previous provider's information. We also recognize that care coordination can be difficult if the member does not trust the provider or struggles with taking responsibility for managing chronic conditions. Our members may also have negative perceptions about mental illness that can impact care coordination. From a systemic standpoint, we recognize there are barriers related to information technology, such as variations in electronic healthcare record systems and inability for these systems to talk to each other. Another systemic barrier may involve how interactions between facilities go. Building a strong, working relationship seems to help minimize this as being problematic. Finally, stigma about mental illness may also exist in various healthcare systems. All of these items mentioned may converge to cause substantial barriers for you in your practice. Centene Behavioral Health's mission is to help people live their best lives by being the trusted partner to create superior solutions in behavioral healthcare and wellness. We simply can't meet this mission without our providers, and appreciate the work you do to meet our members' needs. If you are experiencing any barriers to care coordination or have any additional questions, please contact Hope Tomford at the information provided on your screen. Thank you for attending this microlearning on care coordination. References for this microlearning are shown here. If you would like to review any of these references, please click the pause button and write down the items of interest. To move on from this video, please click the next button at the bottom of your screen.